Hi, good afternoon, everybody. My name is Claudia Sloan, and I'm with BettyBot, not to be confused with the Veggie Bot. I've been on healthcare administration for a little bit over 10 years, but I started out in software engineering, and I spent about 8 years there. And I teamed up with my husband, Brian Sloan, who has over 20 years of experience in software and hardware engineering. We also had three virtual members. They were more like our advisors. Rogers Wilson is a doctor in Arizona. Laura Nelson, also a doctor in Arizona. And Marilena Ochoa, who is a medical consultant with more than 40 years in experience in healthcare administration. So a quick fact, 15 to 25% is the number of people who are discharged from the hospital and readmitted within 30 days each year. What does that mean? This is people that have chronic illnesses, heart failure, just a number of different illnesses. But I picked COPD, chronic obstructive pulmonary disease, as one example because 250,000 people get admitted to the hospital each year for COPD, and 25% of those get readmitted within 30 days. That's about 145,000 people. But more importantly, what this means is that about $57 billion to $95 billion is the cost to hospitals. And sadly, or I don't know, happily, I don't know, these costs are not reimbursed because these people are readmitted within 30 days. And about 70% of them is because exacerbations with the same disease, or they come in with the same diagnosis. So no one pays for that, and sometimes the patient has to pay out-of-pocket costs. The good news is that many of these readmissions can be preventable. So we built BettyBot. BettyBot is a sensor-based technology that provides constant monitoring and communication. This is So basically, when the person gets hospitalized, upon discharge, the person will receive our BettyBot and would be given BettyBot for 60 days to take home. At home, the device will be monitoring their oxygen levels in their blood, pulse rate, breathing rate, blood pressure, body temperature. Plus, it also has a pedometer so that they can use it for their activities as well. So we spoke with several MDs and some nurses about the importance of early intervention, and they were very positive about the possibilities. One of the problems that they have is that once the patient leaves the hospital, they have no control of what the patient does at home. So they have no way of monitoring their vitals or anything. We also spoke with some seniors who get hospitalized often, and certainly they do not want to be readmitted to the hospital that often. So they talk about they would be willing to wear something in their hand, even if it's for 30 days or 60 days, if it would help them keep away from the hospital. With the COPD example, one just very brief example is that our BettyBot could measure the oxygen level in their blood, and if it falls below a certain threshold, then an alarm would be sent to a call center from the hospital. A person from the call center could actually see the alarm and do a quick at-home intervention via phone, for example. So it could quickly just call and assist the person through easy, relaxing steps or ways for the person to breathe better. It could increase the dose of oxygen intake if the person is under oxygen therapy, or it could do maybe a dose of an anticholinergic, which is a prescription drug that they get to help relax the muscles surrounding the airways. So the revenue model is we would sell the device very close to our cost. It costs us close to $45 to create each device, and the sales price would be about $50 per device, and that includes a wireless connectivity for 60 days. We would have an online secure interface that comes with this so that hospitals and healthcare providers can be monitoring the data for the patient. So what is the market opportunity? I think many of you know that the wearable technology is blooming. In 2015, the market had a growth from $20 billion and is expected to grow all the way to $25 billion by 2019. The medtech market also is a growing industry with $440 billion currently. Some key competitors are obviously home care services, but realistically, you can't really have somebody monitoring a person 24/7, especially if the person doesn't have the high risk that needs it. So the expenditure on home care services right now is $73 billion per year. At-home devices, there's oximeters like that one right there, so the persons can go and measure their oxygen levels, but they have to remember to go there, so it doesn't provide constant monitoring, and it also does not provide the communication with the hospitals. So we believe that BettyBot is a win-win for all hospitals and for patients. Reduced costs for all, payers, hospitals, patients equals happier patients. Thank you.
Well, great job, and you certainly hit on a need in the market for better care and lowering costs. What is the market? This is sort of like Fitbit bot in a way, right? It's that same idea. What is the market out there? Are there other competitors who are already in this area?
Well, what we saw for competitors are, you have the Fitbit, for example, but the Fitbit doesn't have communication with hospitals or with PCPs or with anybody who needs to be viewing that data in order to prevent and do an at-home intervention. So that connection is missing. And we also saw devices like the oximeters, for example, which is, I think I had a picture of one of them, that device at the bottom. So it's something that the persons can go and put their finger in it and measure like oxygen levels. And there's all the other sensors. Somebody else had a presentation with all the different sensors. So we basically have all the different sensors into one. These sensors do not have the communication piece either. So we're kind of bridging the communication piece that is missing there.
Have you been able to actually build a model that functions?
We have most of the sensors in this little bitty board. The only sensor that we're still working on is the oxygen measurement piece. So we're waiting actually for a part to come that we can incorporate into it. However, the technology does exist. That's what we're waiting for. It's basically a light-based technology. We're just waiting for the part to arrive so we can figure out how to make it work. So most of the other sensors already do work.
Mm-hmm. Will there be significant regulatory approval necessary?
We expect to have some FDA approval to go into that, and depending on what kind of partnerships we start having with providers, we might have to have some HIPAA and other, challenges that we may have to go through. Coming from administration, I know there's a lot of hurdles, but since we're mostly just an in-between monitoring and we're not accessing patients' data, we think that it's going to be a little bit easier than it sounds.
Mm-hmm. Right, thank you. Other questions?
Yes, and you're absolutely right. So what we're working is mostly with the call centers that the hospitals have. So one of the call center specialists would be monitoring the alerts, and they would already have steps given by the hospital experts as to what to do when it falls to a certain level, like what type of interventions to provide. And those would be the persons that would call the person and say, hey, I see that your blood level is at X%. Have you tried this or have you done that? Depending on the specific patient recommendations from their own doctor. Now, not every single provider has a call center, so that would be something that we would have to work with individual provider as to what can they do.
Have you checked on patents? I know with the Fitbit and iWatch and all this, there's so many things probably in that device that is already patented. Have you checked on any of that?
We have to get more into that. Our device is incorporating sensors that were already out there developed individually. So there are devices that do like the Fitbit, but they don't have a specific use for healthcare. It's more fitness and wellness. And so we haven't seen one that is specifically for that niche. So if we were to patent it, it would probably be a utility patent for that niche or something along those lines. But yeah, we have to do more work on that area. We've been so focused on the hardware.
Good idea.
Thank you.
I might have been distracted on that slide when it said that it was going to cost $45 and you were going to sell it for $50. But Was there another line that I just missed on where the revenue stream was? Where
Well, what we were thinking is that it would become more of a membership product over time, where we can actually charge per patient being monitored during the time. But we haven't totally digged into the possibilities. So to start with, I mean, we would want to get it validated and ensure that it actually works and that it helps people. So we would want to sell it at cost or really close to cost at first to get it out, and then as it becomes first of all, as we provide more things with it, then we would incorporate the membership piece of it. So the membership piece would be for the actual cloud services, data storage and the monitoring and the tools that they would use to track and monitor the patients.
In the example you gave, the hospital appears to be the largest or the biggest gainer if a person is readmitted within 30 days and they aren't recuperating any of that cost because it's the same thing. Is it the hospital that would be paying the subscription cost?
Yeah, we would expect the hospital would make more or would lose less by having this expenditure because the amount of dollars that they're losing per year on readmissions is very high. So that's where we think they might be able to. I've worked with Medicare before, and there are things that Medicare oftentimes wants to pay for, but I haven't gone into that path yet to see if they would want to, if that would work.
So have you communicated with actual hospitals in terms of if they would be interested in this product?
Yeah, well, there's 2 hospitals in Arizona. One, Dr. Wilson is medical director for one of them,
Okay.
and he mentioned interest. Obviously, he would need to see all the specifics of it. We talked about it conceptually and so forth, and got really excited. But I don't have a customer yet.
And what about battery life? It seems like all these wearable devices, if you measure your heart rate or anything like that, they really require a lot of battery life. How are you going to handle that?
This one has a rechargeable. The person has to plug it in, so it's a 12-hour battery that comes with it.
Very good.
And
Now hang on one second because we might have a couple extra questions from the judges because for this. So add 2 minutes, please.
So I have a couple of questions. Since you spent a lot of time about the Ardor, seems to be very well advanced at this point in time. How precisely are these sensors in terms of measuring temperature? Of course, that is easy, but pressure and other parameters, because ultimately that will be the decision-making process to admit or not. And then at the end of the day, who is going to take that decision to admit or not?
They're very precise. I mean, when we tried it, it's within less of a degree, like for temperature. And
Temperature is easy, yeah. All the other parameters are difficult.
Yeah, but as far as who decides when to readmit a patient or not, I mean, that would be based on the threshold that the hospital staff provides. So they would be the ones that says, you know what, I'm comfortable with having it at no less than, X amount. And then we set the flags in the software so that you should never let it go, higher or lower than that amount. And that leaves a little bit of cushion for them. But that I would leave that to the experts because that really is it would be their decision to say how much threshold they can handle. That can be a big liability problem. Mm-hmm. Okay, so for the call center specialist, we would have a cloud-based, call it portal or access point. So they'll log in. It's a secure, password protected. So they'll log in and they basically get to see the patients that are being monitored. And the only data that they see is obviously whatever ID we give to that patient, but then the measurements from the device. So they're not seeing any other patient information or anything like that because that's on their own end. So this is basically the portal that we would provide through our membership-based service. Does that answer the question? Yeah. Any others? Thank you.